Earlier this month, transgender woman Sasha Wall was shot and killed while driving her car in South Carolina, making hers the 8th known transgender murder in the U.S. in just the first few months of 2018 alone, according to the Human Rights Campaign, which tracks violence against transgender people, counting a total 113 murders since 2013. Transgender people are also more than twice as likely to be living in poverty, according to the National Center for Transgender Equality, 49 times more likely to have HIV, according to the Centers for Disease Control and Prevention, and are more than 120 times more likely to be homeless, according to a study by the University of Chicago. Most leaders would recognize that such a vulnerable population needs to be protected. Donald Trump is not most leaders. On the campaign trail, he said he would fight for the transgender community.
As your president, I will do everything in my power to protect our LGBTQ citizens.
But it's not clear Trump understood what the T in LGBTQ stands for, because since taking office, he hasn't exactly lived up to that promise. The New York Times reports that now the White House is planning to roll back a rule that prevents doctors, hospitals, and health insurance companies from discriminating against transgender people. Could this even leave the door open for doctors to refuse emergency care to transgender people? Last month, the president approved a rule banning transgender Americans from serving in the military, even as they are twice as likely to serve as the general population. The decision went against several defense leaders, including his own top military advisor, Joint Chiefs of Staff Chairman General Joseph Dunford, and is now on hold while civil rights lawsuits continue. And last year, the president included transgender on a list of words the CDC is not allowed to use in budget proposals. During the election, Trump sounded like he was committed to making strides for the LGBT community when he weighed in on proposals to regulate which bathroom transgender people can use in public spaces.
I think it's pretty simple. Let the states decide. And, you know, we have to protect everybody.
I think it's pretty simple, too, Mr. President. Undercutting transgender people's right to medical care or to serve in the military or to be counted at the CDC are gratuitous, sadistic attacks on some of the most vulnerable in this country. Protect everybody? Hardly. It's time for the rest of us to make ourselves heard.